important thing here is the recognition that 94% improvement in BII symptoms. The cytokine, those 3 cytokines still, if I understand correctly, then they're significantly elevated in the BII patients, but not in all BII patients. Well, is that correct?
There were 3 that were statistically higher. The problem is we don't have definitive numbers of what's a high level or a low level of cytokines. So it's very, this was Marshall Caden's part of our study, and it's there's not any specific levels that are known to be higher or lower. These patients, we just found 3 that were statistically higher, but they were in 3 for the for 1, 6 in 1, and 8 in 1. So they were not in a majority of subjects. And they all did have other potential causes for their symptoms, that they could have elevated cytokines as well.
I guess what I'm getting at is for that patient who's really, really, really not wanting to remove their implants, but is nervous, has seen a lot of stuff on the internet about symptoms and thinks, is this menopause that I'm having, or is this BII? Is there still, if I say, well, we can maybe try these 3 cytokines and test them, and if it is higher, then that would suggest that it's probably more BII than it is menopause?
I don't know that we can make, that's a little bit of a stretch to make the direct association between an elevated, we had non-BII patients that had higher levels of, some had higher levels of the cytokine. So I don't know if you could make that, but I think these patients, what's really important is these patients have to have a full workup before we operate on them. And part of that workup can include anything. I saw a patient yesterday that she'd had heavy metals tested. she had cytokines tested, or ANA was negative, or rheumatoid factor was negative. Everything was negative on her, but at least we looked at those things and made sure it all had been done prior to having surgery. So yeah, is that something you could test? Of course. And IL-17 is an indicator of autoimmune. IL-13 seems to be more allergic. So yeah, those are things that should be tested, and potentially, so the majority of patients get better after their implants are removed. That's good news.